My name is Dr. Kyle Bester, and I'm a registered research psychologist and senior lecturer at the University of South Africa. I'm also an executive committee member within the Division for Research and Methodology. A warm welcome to everyone tuning in to our Dear In podcast, where we do and speak research psychology. Now, our topic today focuses on the role of research psychology within the clinical landscape of South Africa. We are also going to discuss how research in psychology informs and enhances mental health care practices tailored to the unique needs. Now, research psychology is essential to the clinical landscape as it provides the empirical foundation for effective, evidence based practice, improves our understanding of mental health disorders, drives the development of new treatments, enhances existing interventions, and facilitates preventative efforts and informs mental health policies as well as advocacy initiatives. Now, all of these facets speak to the importance of research in organizations, but more importantly, how a scope of practice may advance the overall psychology discipline in South Africa. Now, without delaying the reveal of our guest, I have the pleasure to welcome Omphile Rammopo to our Dear In podcast. I also need to highlight that Omphile is an executive committee member within the Division for Research and Methodology. Now, Omphile holds a master's degree in research psychology from the University of Johannesburg. Currently, he is an intern clinical psychologist at Dr. George Mukari Hospital, having completed his training at Safako Mogatu Health Sciences University. His research revolves around men's mental health, reflecting his commitment to understanding and addressing the unique challenges they may face. Additionally, he's also interested in engaging in neuropsychological research and the applicability of different psychotherapeutic modalities to the South African population. Omphile, welcome, and it's good to have you.
Thank you very much. Thank you very much, Kyle. Very lovely to be here and to speak all things regarding research psychology. And as you said, this applicability to the clinical practice. I feel that we need to have more conversations around these, but yeah, I cannot wait to get started with you.
Awesome. Now, one of the aspects that I really wanted to touch on, man, is that you are registered both as a research psychologist and a clinical psychologist, interclinical psychologist. Now, in terms of bridging those specific practices, not practices but disciplines, um, where do you see the synergy between the two?
Mm. The synergy between the two, I believe that, everything that we are doing on the clinical front stems from the research that was made. So that's where the beauty comes in. So research psychology, bringing us basically evidence-based practices which are then applied in the clinical psychology space. Because in the clinical psychology space, everything is evidence-based. So if something is evidence-based, it means that it comes from research. So you cannot separate the two essentially. So I think I have the advantage of having gone through the research process and then starting my clinical practice right now in terms of being a intern clinical psychologist. And I think that provides an advantage because one is also able to see the change that is happening in our treatment modalities and how they apply in our South African context, especially when one continuously engages in this research. So you cannot separate the two essentially. You cannot do that.
Definitely. And you mentioned that you essentially coming from both worlds, essentially the research perspective and now the clinical perspective. I
Mm,
think that really gives you that added, perspective of viewing the entire scenario of the psychology discipline as a whole.
mm,
Because sometimes we tend to compartmentalize the registration categories.
mm,
Research is on its own, the clinicals are on their own, and the neuro guys are just there, you know.
mm, mm,
So we tend to separate the two, and actually, research plays a very important role. And I will be very cautious to also say that we play a supporting role, but we
yes.
actually fit in all of those categories. Um, but yeah, but now how has research impacted your understanding of mental health care practices? since you are doing, clinical work and you do function in a hospital setting. So how has research impacted that particular aspect?
So research has impacted it in that it actually makes me view for example, my patients from a holistic perspective, so to speak. So instead of also just viewing a patient from purely a psychological lens, research also broadens that understanding into saying that because other individuals who also do research, you'll find that there's biological perspectives of mental health. You'll find that there's also social issues that come in and inform our mental health issues, even spiritual and cultural factors. And all this also stems from the research that has been made. So it assists one in being able to look at a patient from a holistic perspective instead of just looking at them from a one-sided perspective. Because once you only look at that one-sided perspective, you would lose, usually you are losing your patient because you're only just treating one thing and other things would not be considered. So we found ourselves in an issue where then nothing essentially would be solved. So I think research has impacted me on that lens, being able to just view individuals or patients from a holistic perspective.
Would you say that that approach of viewing the individual or the patient from a holistic point of view, do you think that's partly due to the training that you received at a research level or when you did your research masters? Or is it purely based on your experience as it built up? You've gone through the research, training grounds.
Mm.
Now you're in clinical space. And would you say that life has, in a sense, guided you to approach it in that perspective, viewing it as a whole? Yeah, I'm interested to hear what are your thoughts on that.
On my side, in all honesty, it would be the research because, with research, although you would be in a space of, let's say, we're saying research psychology, where it's like research that purely focuses on psychology, but with research, it's never really like that, where it's just purely psychology when research is done. Because when you're doing your own research, like when I was doing my research psychology at UJ, as you also delve deeper into research about the topic that you are doing, you would obviously read even literature from other what is this you will read from other professions. So once you also engage with other professions, then you're starting to see that okay, there actually also are different perspectives, and they're explaining it differently, but after a while you even find that it can essentially link to what you're also doing. So the research is the one that broadened my understanding or that made me view people from this holistic view instead of being linear. So I think once an individual starts engaging with research, you're exposing yourself to a world of different ideas. Then it moves you away from a linear view, and then yeah, you become all-rounded essentially, leading to this view that I have also of an individual as a person who's complex instead of just being, a one-sided linear view.
Yeah, no, definitely. I think part of the idea of experience and this whole thing of viewing the person as not just this linear, this
Mm,
straightforward thing. I think as people we are flexible, we wax and we wane. And I think that that approach that you have of viewing the individual as a whole and adding your idea of experience, your research experience, your clinical experience, I think that is a good approach in
mm.
terms of dealing with your patients and your clients. But one of the other things I actually wanted to touch on is what are the key research priorities in mental health that you picked up that are
Yeah,
most that are most pressing, for individual needs and in our community settings?
yeah, at this current moment, personally, from what I have seen based on uh, basically what is happening outside and also in terms of research, the research priorities would be on the trauma, when we talk about trauma-informed care or trauma research, because we are also essentially staying what we're seeing in our country happening. There's a lot of trauma that is occurring, and it's usually it's trauma that does not even happen once we're usually exposed to trauma multiple times. So there's a lot of research that maybe we might need to get into in terms of that to see the impact on different populations, especially in populations where this trauma is essentially something that would be reported multiple times in a week, in a day, or things like that. And then we also have challenges of gender-based violence. So the impact of GBV on mental health is something that I think is quite essential. And also, research needs to be done also on the perpetrators. We really need to have more research on that. And another essential one is substance use and mental health, especially in
Mm.
our country. It's also another one that I think it one of the priorities because it can really assist some of the communities that are finding themselves with some of these challenges on their day to day. And even one of my interests, and I think it's becoming quite popular in research now, but it has always been there when you have your Prof. Ratelo who's done this research. It's research on men. Men studies is quite essential. We really need to delve deeper into that too. That's one of the research topics that I think is should be put out there for most of the researchers.
Definitely. I think Professor Atele's work is really instrumental when it comes to the idea of male sexuality in South Africa, or just to identifying and re-identifying and reconceptualizing the idea of what it means to be a male within modern South Africa.
Yeah.
Um, yeah. Apart from that, I also think the stigma associated with GBV. Um,
Yes.
there's a lot going around, and I think research will allow us to actually shed light on those issues of trying to hide it, trying to not share it, and I
Mm.
think that the complexities around GBV,
Yes.
but also your research interest is a particular important aspect that needs to be highlighted in a South
Mm.
African context, and have to bring it home to perhaps one of our younger listeners to the podcast would perhaps find this relatable. I saw a meme the other day, and it was this whole saga about P Diddy and Cassie,
Yes.
and this meme said there's a lot of Cassies walking around and
Mm.
there's a lot of Diddy's walking around,
Yeah.
and that particularly hit home because if you look at society as a whole, it's almost, you almost have to repress or not speak about the fact that we need to get help, or if you need help, you have to almost shy away, because you'll be stigmatized or
Mm.
branded as a victim in that sense. So I think work in that area is particularly important, especially since our GBV rates in South Africa is particularly very high.
Mm. Exactly. Mm. Mm. I think that's
So,
quite important.
definitely. On that note, how do you think research can actually help identify and address disparities in mental health outcomes across various population groups?
Mm. So I think research can help address these disparities in the mental health outcomes by we need to have more research that is utilizing the people's voices. Now we need to explore how different cultures might perceive mental illness. Do they even have preferred treatment modalities, and are there potential barriers to possibly seeking help so that one can then find ways in which interventions can be tailored to the different communities because there might be different mental health outcomes because the modalities that are utilized might actually not be a fit for certain populations. Because as we know, psychology, most of the research that we actually have or some of the most modalities that are used even in clinical practices are not purely South African or are not even African. It's there are modalities that were developed outside of Africa or outside of our country, and so it might be a difficult one in being able to see how some of them can be effective for our populations that have different experiences, different cultures, different viewpoints. So, and and in the way that they also describe mental health, it's very different. I mean, in some other cultures, you do not even have words that can be directly translated to some of our mental health disorders to show that they might not even understand it from the way in which that we are giving it to them. So that can lead to different mental health care outcomes. So research then could come in and say, then let's listen to our people. Let's listen to the people in different communities. Let's just hear them. So more of the qualitative studies on my side could potentially benefit us in the long run in being able to also tailor our interventions in a way that we are not coming with different theories that might not fit our populations.
Definitely. Thanks for that. I definitely do believe that even in terms of instrument development, psychometric instruments in a South
Yeah.
African context, I believe there's a shortage of South African-based homegrown tests that
Mm,
have been designed for South Africans.
mm,
Uh, and like you say, similar to in terms of your treatment modalities and your treatment plans and your treatment programs and how we actually understand it from a South African perspective, I think it is also limiting in that sense where we are basing our findings on instruments and programs that were developed in different country and may not
mm.
really be context specific or context applicable to what we have in South Africa. Like you mentioned, there are words in our African languages that do not even fit the instrument aspects or the factors of those particular instruments that have been designed because they were designed in Europe or the West, for example.
Yes, yes. And I think that one, I'm glad that you're even bringing that one up because it has potential detrimental consequences, these psychometric tests, especially let's talk about school-going children when we're talking about school-based assessments. When we are using some of the psychometric tests that have not actually been properly validated in our country, and we make decisions about certain diagnoses based on them, and then also these children will then be put on different schools possibly because of the findings of that. But you might actually find that because of these, some of the psychometric tests are using certain English, they are using the English language when not everyone in our country speaks English, or they might even have information that is being asked to some of these children that you might not generally be exposed to in your community. Some things are not seen in different communities, but they are asked in the psychometric test. So it might not be as reliable as we think it is. But at the end of the day, we end up making decisions for some of the school-going children, for example, based on these psychometric tests. And we give different diagnoses that can affect even which school that they might go to. But I think that one is very, very important for us to actually consider, especially also for school-going children, because school-based assessments are done at a they are done a lot. Every single day, actually, a child will be assessed and a decision about which school they are going to go to will be made. But when you look at the psychometric tests that are utilized to assess this child, you might find that they have not even been validated for use for our population. So that can be quite concerning sometimes.
I agree with that one because if you look at our selection tools that some of our organizations still use in the governmental sector, we tend to use specific tests that have outdated norms,
Yeah.
right? And then on that point, let's say, for example, we have a candidate or a participant that speaks an African language, and English is the primary mode of that particular test that is being offered. Sometimes that particular individual language, for example, English is probably their third or their fourth language. And
Mm,
it goes to that point, what you're saying is that we're not properly building certain mechanisms when it comes to language into our testings
yeah.
in which we offer to certain people in South Africa. And I definitely feel that um, the psychometric capacity and the ability for it to be developed needs to be advanced in South Africa going forward.
Mm, mm, exactly. Mm.
Awesome. On that note, because you were sort of like blending your research with your clinical, how do you see interdisciplinary research playing a role going forward in addressing mental health issues in South Africa?
I think that's also, yeah, that's a very good question. You know, research and interdisciplinary research is could be quite essential in understanding mental health, because mental health can be understood from different domains. Hence, we in the clinical side, the clinical psychology, would speak about the biopsychosocial model to show you that mental health, it's not essential to only be looked at through only a psychological lens, because this psychological manifestation could come from things like your biological mechanisms, or even social challenges, or even spiritual challenges that one might have. So interdisciplinary research might be essential, where when we look at the biological side, a psychologist doing research, let's say with a neurosurgeon or somebody involved in, yeah, someone doing neurophysiology or anything neuro related, and working with a psychologist in understanding mental health, we can come with a whole lot of information that might not be understood well, because we find that some psychological disorders also have a biological basis. And we also then come on the social side and speak of, we have sociologists, we have social workers that are also engaged in research that can work well with psychologists, because there are also social issues that are causing some of the mental health challenges that we see. So purely just treating the psychology might not be essential. So then we need to really work together, because every other profession actually would be able to bring a different perspective. And that also would then help in terms of interventions. Because, for example, another example that I think is very great is when we speak about a psychiatrist and a psychologist. Of course, psychiatry does deal with psychology to some extent. However, they usually treat their biological lens. So it is always essential to know that, okay, if there is medication that will be involved, it is treating the biological side. And then we have psychotherapy involved that is going to be working with the psychology of the individual. So that is interdisciplinary. So even if research would be involved of a psychiatrist and a psychologist, then we are able to look at both aspects instead of just, as I said earlier, looking at an individual from a one-sided perspective. So I think interdisciplinary research could actually be very essential in understanding and treating mental health in our country, when we look off also at the fact that there are social issues where then you can involve other professionals there. And then in terms of biology also, we have a whole lot of information coming out nowadays that explains the biology of some mental health disorders. So if a psychologist is only working alone, really a patient might be missed and not fully understood.
On that note, I see a lot of people confusing the terms. I'm going to see my psychiatrist.
Mm.
Actually, I'm going to see a psychologist. Do you mind rehashing the difference between those two? I know you touched a little bit on it now earlier.
Yeah.
Um, in simple terms, are you able to just lay it out?
Yeah. So firstly, a psychiatrist is somebody who studied medicine, right? So they're specialists. So before you even become a psychiatrist, you must have gotten your medical degree, and then you specialize in psychiatry. And with a psychiatrist, they do specialize in treating mental health, but most psychiatrists would treat mental health, as I said, basically working on the biological dysfunctions. So they would treat mental health most of the time utilizing medication. And some of them do psychotherapy. However, it might not be intense psychotherapy, similar to clinical psychologists now who do only what we call talk therapy or psychotherapy in order to deal with mental health challenges. So, yeah, a psychologist and a clinical psychologist specializes in using different psychological modalities in order to treat a patient with mental health challenges. So, a psychiatrist would provide that medication, and then a psychologist would then engage with that individual who is also on that treatment through psychotherapy. So it's not that once you are seeing a psychiatrist, you don't need to see a psychologist. It's usually even better to have both, especially if you have severe mental health challenges. A psychiatrist and a psychologist would uh, be beneficial for you, and even research has basically described that very well to show that the true treatment that you're given from psychiatry and psychology, if they're working together, there's a high chance of your a reduction in your mental health challenges. So psychiatry, medication, psychology, psychotherapy in simple terms.
Thanks for that.
Mm.
Final question. What are the implications of research, like the findings for mental health education and training, um, for both the healthcare professionals and the general public? What do you see? How do you see it playing out?
So essentially, it really assists in terms of professionals, it assists us in ensuring that we are continuously utilizing evidence-based practices, instead of only just taking what has already been there or maybe researched elsewhere and then applying it to our populations. So the implications are that it assists us in ensuring that we are using evidence-based practices for our different patients, instead of just taking what is already there. And then it also assists in possibly updating curricula and even training for psychologists, so that other modalities maybe that might not be applicable in our populations, if it has been evidenced through research, then it means that we need to update our curricula and and do things that might be beneficial for our population. So, for example, in my training at Sefako Makhata Health Sciences University, we had a modality called it's African epistemologies essentially. So it was speaking about how we can essentially use some of the findings through this African epistemologies and and to apply them to our populations that we are working with clinically. So it is this new modality that came because of the research that came before it. So it has been beneficial, especially for our populations that we are working with, instead of just taking what has already existed and just applying it to the different populations that we work with. So we can even update our curricula and training, ensuring that it's evidence-based, of course. And then it also helps in ensuring that we are culturally sensitive. Um, Ensuring that we are culturally sensitive practitioners, essentially. This research assists in that. And for the general public, it can help with awareness campaigns, obviously, where we can have address misconceptions about mental health and reducing stigma also about mental health, and possibly encouraging health-seeking behaviors so that we can promote that mental well-being, because mental health is still something that is very much stigmatized in our communities. And sometimes it's because of the different definitions that are put on these mental health challenges that we see. So this can help in basically that. And yeah, that's what I can think of this far. Yeah.
Awesome. Would you say that your teaching within African epistemology has also shaped the way you deal with your patients?
Yes, definitely it has. It has because um there's different learnings that we got before I was exposed to African epistemology. There's different learnings that we got, or different teachings that I got, that really viewed an individual from what I could say and only an interpsychic lens. So as the problem occurring within the person. However, then moving fast forward, I go into a African epistemology space where there's a deeper understanding of also communal impacts, especially in the country that we stay in. We find that most communities are actually more communal and not individualistic. And we find that challenges that arise are actually more communal. So then that approach then it changes my approach to a patient, in that I no longer just view the individual in front of me as having a mental health condition. I also look at that individual's mental health condition through the different systems that they are in, or different systems that they are occupying. So whether it is a political system, whether it's socially. So we're looking at them through all those lenses, because now an African view makes you view the patient outside of that. And then even the ethics, we have the ethics of Ubuntu, which essentially is coming from African epistemology. And it's something that I did not. We know the word Ubuntu, we hear about it. However, it was not in part of my education from, let's say, undergraduate. And then it's only until I started training as a clinical psychologist where I'm looking at it in an applicable manner also as a working professional. So it's like the principles of Ubuntu that are layered down, and we have different professors that I only heard of also that wrote books about these principles or ethics of Ubuntu, like Prof. Ramos, who has a book that speaks about Ubuntu in detail. And then we also have Professor Baloy, all from Sefako Makgato, who speak about these principles of Ubuntu. And they actually do shift the way that you approach your patient, instead of approaching that patient from, just like I say, that intrapsychic view. You are able to view that patient more from a communal perspective, because as Ubuntu is directly translated, ubuntu, like you are a person through other people. So you cannot look at that person in isolation. You have to look at that person through the people that they are with, and that's how you are able to treat them. So you would even find that when you do that therapy, you might end up saying, maybe you would want to also have, if you have, I have therapy with one individual, I might also maybe want to see their parents. I might also maybe want to see their siblings or any other individual that is around them, based on obviously their presenting complaint, instead of just working with that individual. Because after I work with that individual, where are they going to head to? They're going to head to that same community or that same space that they're in, that might have possibly impacted on how come they also have developed the mental health that they're presenting with. So yeah.
Thank you so much for that insightful, answer. And I want to build on this particular question because I think it's been a question that has surfaced in psychology for quite some time, and
Mm.
especially in higher education, where we tend to recirculate our modules and essentially transform psychology and decolonize psychology. And I know it's a curveball question, but in your opinion, how do you think we can transform psychology, given um, your experience with African epistemologies and your readings on your professors, um, and how you've applied the principle of Ubuntu in your own professional capacity?
you know I think the most simplest way, in not to even make it a very complex thing, I feel that the most simplest way to transform psychology is to involve the voices of the people that we are going to be treating, or the people that we are discussing in these psychology, different psychology fields. So basically doing research that really is giving different people of our communities a voice. So we need to hear from them more, so that we can be able to create whichever modalities or perspectives that we want to create based on the lived experiences of our populations. So I think that is the most simplistic answer: more research that includes the voices of the populations of South Africa, instead of, isolating them, and then we end up making decisions for them in terms of what they have and what they don't have, without even considering their lived experiences.
Thank you so much, Umpile. And thank you so much for sharing your thoughts and answering some of the very pertinent questions that we have in terms of how research can be linked to clinical research. I think research is an important aspect to any organization, but more specifically in the discipline of psychology. I think there's a lot of things happening in our social context, and research plays an important role.
Thank you for joining us on the DRM podcast, where we focus on interesting research, fascinating methodologies, and everything in between. Subscribe to the DRM SciSci YouTube channel to access all our podcasts. If you would like to be a guest on one of our podcasts, email us on sisadrm@sisa.co.za or look out for the call for participation on our social media pages and simply follow the submission process. Don't forget to connect with the SISA Division for Research and Methodology on LinkedIn, Facebook, Instagram, and X to stay informed. Thanks again for tuning in.